Good morning, everyone. It's a pleasure to be with you today. First, I would like to introduce myself. My name is Sanith. I'm an RN working in a medical tele unit. Today, I would like to give you a presentation on how to minimize inpatient fall rate by using appropriate fall prevention measures. To begin with, I'll be speaking about the current situation in the hospital. Then we will examine how can we minimize fall rate. After that, I will explain our strategy plan and how it works. And finally, we will discuss about the evaluation methods to assess the progress of the plan. Clear Lake Regional Medical Center is one of the HCA affiliated hospital in Houston area. The mission of the hospital is to provide compassionate care and exceptional service to every patient every day. Vision: to become a world-class hospital by providing high quality and safe care to our patients. Next, we are going to look into the SWOT analysis. According to the analysis, the strength of the plan is increase in positive patient outcomes, reduction in number of falls, easy access to fall prevention supplies, competent nursing staff, comprehensive fall assessment on admission, review use of gait belt, improve in communication between team members, competent in reviewing current medications, reduction in adverse events and length of stay, and the last one is increase in quality of life by decreasing incidence to fall. And weakness includes non-compliance and low commitment in following for prevention measures, lack of communication between members of the team, inadequate availability of supplies and resources, inadequate skills in using gait belts, and malfunctioning issues of equipments. Next, we are going to look at the opportunities and threats of the plan. The opportunities include team building, improving communication skills, improving customer satisfaction and patient safety, ongoing fall prevention education, continuing education and training, fall champion sharing unit. And the threats includes resistance to change, communication and engagement, malfunction of equipment, non-compliant in ongoing fall risk assessment and medication review, and in following fall prevention strategies. The last one is ongoing educational needs. Now we are going to look at the purpose of the plan. Why we need to minimize the fall rate? What is the purpose of doing it? Inpatient falls are a major concern in today's healthcare environment. In our organization, last month we had 18 falls, and the month prior to it we had only 12 falls, and you can see it's trending up. So minimizing fall rate will help to increase the patient safety and increase patient satisfaction. Now, how can we make it happen? Identify fall risk patients by performing comprehensive fall risk assessment on admission. That means whenever the patient gets admitted to the unit, we need to ask the patient about any previous history of falls. We need to review their medications. We need to assess them for their mental status and their gait. Initiate fall prevention measures, which includes fall signs, low birds, bed exit alarms, floor mats, yellow gown, blankets, no-skid socks, yellow bracelet, hourly rounding, and sitter. Improve communication between healthcare providers, patients, and families, and educate patients and families. Now, what is the goal of this plan? Healthcare providers to learn, review, and utilize fall prevention measures to minimize fall rate by 20% within 4 to 5 months to improve patient safety and satisfaction. Who are the stakeholders? Patients and families, managers and administrators, employees, government, vendors and suppliers, and community. Next, we are going to make an analysis on stakeholders. Who all are we going to keep satisfied? Patients, families, employees, suppliers, communities, and the public. And we need to closely manage customers, employees, communities, and the government. We need to monitor suppliers and vendors. Employees, managers, and suppliers. With these three groups, we need to keep them informed all the time. Now I'm going to discuss about the strategic plan. What are the objectives? Role of employees, role of managers or leaders, protocols which include forest interventions, and the policies and procedures. Now we're going to discuss about the role of employees. What is the role of employees in achieving the goal? Like I discussed in the previous slide, they have to do a comprehensive assessment upon admission, educate the patients and families the importance to call for any assistance. Make sure you have the call light at the bedside or within their reach. Then communicate with the team in the report that how high is the risk of fall. We need teamwork. We need to implement interventions in a timely manner. Employees need to be aware of the resources available to help these patients, which include fire lifts, gate bells, walker, etc. Next, we are going to discuss about the role of managers in making the plan successful. What is the role of managers? They need to make sure employees have enough resources in the unit to assist these patients. Observe the staff if they are compliant with the plan. Check charts for documentation. Round on patients to observe if the fall prevention measures are in place. Acknowledge employees for their hard work. Encourage employees to participate in fall committee. Next is fall risk interventions. We have interventions different for different categories. Low fall, there are patients with low fall risk, moderate, and high fall risk. And the interventions using for these patients are different. Policies and procedures. Policies and procedures are available on the intranet of the organization. It's open for all the employees and they can review it anytime. And also they can use administrators, leaders, or managers as their resources. Next was the communication plan. Upward communication, downward and lateral communication channels are available for communication. CNOs, administrators, and managers will be updated with the progress of the plan through official communication channels. The final part is evaluation. How are we going to evaluate the progress of the plan? Observation of the employees to see how compliant they are in performing assessments and implementing interventions. Gathering feedback from employees and patients, audit charts, case studies, monitoring and feedback system, and we use surveys. To conclude then, we have discussed about why we need to minimize the fall rate and how can we do it. We also discussed a strategy plan where we discussed the role of employees, role of managers and leaders, and how can we access the policies and procedures, and what are the interventions we can use for high-risk patients. So, the number of falls can and must come down. Thank you for being so attentive. Now I would like to give you all a chance to express yourself. If you have any questions, please feel free to ask. Thank you.